Hi, I'm Richard Dargan, reporting for Daily Bulletin. I'm talking with Dr. Jonathan Mezrich, Associate Professor at Yale University School of Medicine, and Dr. C.T. Lin, Professor of Medicine at the University of Colorado School of Medicine and Chief Medical Information Officer at UC Health. They presented an RSNA 2023 debate session, 21st Century Cures Act Information Blocking Provision, Friend or Foe, discussing the challenges and opportunities this provision raises for radiologists, patients, and the entire healthcare team. Thanks for joining me today. Dr. Mezrich, will you briefly explain the information blocking provision of the Cures Act and the implications for radiology reporting?
Sure. So the information blocking, this is part of the Cures Act final rules. And basically, starting in 2021, it's required the immediate release of medical records, including radiology reports, to patients. Basically, you'd write the report, sign it, it would go directly to the patient. There are a number of exceptions to that, but for the most part, patients are receiving the reports immediately.
In what ways will this requirement empower patients in their healthcare decision-making?
Well, the goal is to increase transparency and allow patients to become their own advocates, become part of the healthcare team. It'll allow them to catch errors, to read the reports and know what's going on with their care, and ensures follow-up. It's a big benefit to the patients just because they're no longer treated paternalistically and here's what you need to know. They actually are part of the loop.
I'll also add to that, if that's all right. I think there is a concern about failure to diagnose. Like in the high volume transactions of medical care, it's not infrequently that we clinicians will miss reading a report, or you'll see a report and I'm going to get to that later, and then we forget because we're so busy with other crises to follow up on every single test result. And who better than the patient, who is ultimately most invested in their own care, to say, hey, did you not see this? Am I supposed to do something with this? And so having a backup of the patient themselves expressing concern can help us do a better job for patients. That's on the one hand for test results at all, and then secondly, our previous behavior of delaying test results for 7 days, 14 days until the doctor has time to get to it results in patient anxiety and a sense of not knowing, right? Don't you have the result yet? Is it a week later? Is it 2 weeks later? To the point where there's so much delay that our patients are calling our medical records department and going around the doctor to say, well, I have to have my result. No one will talk to me from the clinic. I might as well get it for myself. And then we're back in the same boat again. So the rule getting us to immediate release challenges our clinicians to say, you have to make time to talk to patients in near real time. You can't sit on it for 10 days, whatever it was that you were doing before.
I've just had one more question, and you both can tackle this, but Dr. Lin, first you. What steps can radiologists take to mitigate anxiety for patients who might be reading their reports without physician guidance?
I think this is a new world. As we were talking about in our session, even our airlines have increased transparency. You can now ask, where's my bag? And it'll tell you exactly where in the transport it is. Is it in the belly of the plane? Is it on the cart? Is it just about to pop out? And if this is the standard for consumers to be able to know that, then what are we doing holding on to radiology reports for 7 and 14 days? I think the new standard is, I want to know what I want to know. We actually did a research study with patients who already had received normal and abnormal results, and we asked, what fraction of you would like to continue to receive results immediately? And the number is 95% want to continue to receive results immediately. And even patients who have had abnormal results, 94% of those said, I'd like to continue to receive those results immediately. Patients are very much invested in wanting to see those results. And we, as a response for both radiologists and internists, need to move upstream. One of our ideas is anticipatory guidance. I'm about to order this result. This is what you can expect if it's very abnormal if it's cancer, and this is what you can expect if it's normal, so that you know where we're going and how we'll reach each other. I know that among radiologists, a growing fraction are publishing their phone number. If you have a question, you can call us, and the worry is the floodgates will come down, and as we were talking about in the session, many radiologists who've done that, their entire program, they get 1 to 3 phone calls a year from patients. So the anticipated flood of, oh, I won't be able to do my regular work, very few patients call. And those who call are pointing out major errors in the report. And so, yes, we want to know that. So I think it's a win-win if we're more transparent.
Okay, I agree with what CT said. I would, in terms of what the radiologist can do, I would suggest that you just be aware that you're writing for 2 audiences now. You're not just writing for the ordering doctor. You're ordering also, you're writing for the patient who's going to read your report. So you want to eliminate jargon as much as possible. You don't dumb down the report, but you can make it clearer. And you get rid of acronyms that a patient might not know. You don't want them to be concerned that it says SOB in the report and think that means something other than what it means.
Well, thank you very much for your time today. For more information about the study, look for this RSNA 2023 session on demand. And as always, you can find more radiology news at rsna.org/bulletin.